Understanding blood clot formation. Risks to our health. Blood clots serve as a fundamental element of the body's defense mechanism, playing a vital role in the intricate process of wound healing. When injury or damage occurs to blood vessels, the body promptly responds by initiating a clotting cascade, a complex sequence of events involving various proteins and cells. This clotting mechanism is a crucial aspect of hemostasis, the body's mechanism to prevent excessive bleeding. It acts as a protective barrier at the site of injury, swiftly forming a mesh-like structure. Composed of fibrin strands, platelets, and clotting factors. This mesh effectively seals the damaged blood vessel, stemming the flow of blood and preventing further loss. In a typical scenario, once the healing process begins and the injury heals, the body regulates and dissolves the clot naturally. However, when clot formation occurs inappropriately within blood vessels, away from the site of injury or without a clear reason, it presents a different scenario altogether. This aberrant clotting, termed thrombosis, poses serious health risks. Thrombosis involves the formation of clots that disrupt the normal flow of blood within veins or arteries. Instead of aiding in healing, these clots obstruct blood flow, leading to potentially life-threatening complications. When clots form in veins, venous thrombosis, or arteries, arterial thrombosis, they can cause severe issues depending on their location and size. There are two primary types of blood clots. 1. Venous clots, thrombus. These occur in veins and are often associated with conditions like deep vein thrombosis, DVT. DVT typically forms in the deep veins of the legs or pelvis and can cause swelling, pain, or redness in the affected area. If a clot breaks loose and travels to the lungs, it can cause a potentially life-threatening condition called a pulmonary embolism, PE. 2. Arterial clots. These form in arteries and are often associated with conditions like coronary artery disease, CAD. Arterial clots can lead to heart attacks or strokes by obstructing blood flow to the heart or brain, causing tissue damage or cell death. Health risks of blood clots. Blood clots pose significant health risks, potentially leading to severe and life-threatening complications if not detected and treated promptly. Some of the primary health risks associated with blood clots include 1. Pulmonary embolism, PE. If a blood clot breaks loose and travels to the lungs, it can cause a pulmonary embolism. This condition obstructs blood flow in the pulmonary arteries, affecting oxygen exchange and causing symptoms such as chest pain, shortness of breath, rapid heartbeat, and, in severe cases, can be fatal. 2. Deep vein thrombosis, DVT. Blood clots that form in the deep veins of the legs or pelvis can lead to DVT. The affected area may become swollen, painful, red, and warm. If left untreated, DVT can break away and cause a PE. 3. Stroke. Clots that travel to the brain can obstruct blood flow, leading to a stroke. Symptoms may include sudden weakness or numbness in the face, arm, or leg, difficulty speaking, vision problems, and severe headaches. Strokes can cause permanent neurological damage or be life-threatening. 4. Heart attack. Blood clots that block arteries supplying the heart muscle can lead to a heart attack. Symptoms include chest pain or discomfort, shortness of breath, nausea, lightheadedness, and pain in the arms, back, neck, or jaw. A heart attack requires immediate medical attention. 5. Organ damage. Clots that lodge in other organs, such as the kidneys or intestines, can cause organ damage or failure, leading to serious health complications. 6. Chronic conditions. In some cases, blood clots can result in chronic conditions like post-thrombotic syndrome, characterized by chronic leg pain, swelling, and skin changes. Blood clots can arise from various circumstances and conditions, heightening the risk of potentially serious health complications. 1. Prolonged immobility. Extended periods without movement, such as bed rest, sedentary lifestyles, or long-haul flights, can impede blood circulation, elevating the likelihood of clot formation. 2. Surgical procedures. Recent surgeries, especially major operations requiring extended immobilization, pose heightened clotting risks due to surgical trauma and reduced mobility during recovery. 3. Age and hormonal influence. Advancing age, particularly individuals aged 65 or older, is associated with increased susceptibility to blood clots. Moreover, hormone-based medications, like certain birth control methods or hormone therapies, can contribute to clotting tendencies. 4. Cancer and treatments. Individuals with cancer or undergoing cancer treatments face higher clotting risks due to cancer-related factors and the impact of treatments on blood coagulation. 5. Trauma or severe injury. Significant injuries, such as fractures in the hip, pelvis, or leg, or substantial bumps or bruises, can prompt blood clot formation due to vessel damage or extended periods of immobility during recovery. 6. Obesity and lifestyle elements. Obesity poses a risk factor for clot formation, as it strains the cardiovascular system. Sedentary habits and unhealthy lifestyles compound these risks. 7. Medical conditions and history. Pre-existing medical conditions, encompassing heart diseases, varicose veins, previous strokes, or a history of blood clots, heighten an individual's susceptibility. Moreover, a family history of blood clots can also elevate personal risk. 8. Travel-related scenarios. Long-distance travel via car, airplane, bus, or train, especially journeys lasting over an hour, can increase clotting risks due to extended periods of immobility. Certainly, recognizing the symptoms of a blood clot is crucial for prompt identification and seeking necessary medical attention. Here are the symptoms associated with a blood clot. Blood clots can exhibit various signs, and being vigilant about these symptoms can aid in early detection. Swelling in arm or leg. Noticeable and sudden swelling in an arm or leg, often accompanied by a feeling of tightness or increased girth, can signify a possible blood clot. The affected area may appear visibly larger than the other limb. Skin redness. Redness or discoloration in the skin over the affected area is a common indication of a potential blood clot. The skin might appear redder than usual, indicating inflammation due to clotting. Soreness or pain. Persistent soreness or pain in the arm or leg, unrelated to any recent injury or exertion, can be a sign of a blood clot. The discomfort may feel like a dull ache or tenderness. Localized warmth. Sensing a warm or hot spot on the leg, particularly if it is localized to a specific area and unrelated to environmental temperature, could indicate the presence of a blood clot. Additional symptoms in severe cases. In more severe cases where a blood clot has moved and lodged in other parts of the body, symptoms might include chest pain, difficulty breathing, rapid heartbeat, or coughing up blood. These could indicate a pulmonary embolism, a life-threatening complication requiring immediate medical attention. Thank you for tuning in. In our next video, we'll delve into the topic of natural ways to prevent blood clots. Stay tuned.